Well, again, good afternoon, everyone. If you're on the West Coast, good morning. Welcome. Thank you for setting aside time in your day to be part of this conversation. My name is Ben Odell, and I have the privilege of serving as the Deputy Director here in the U.S. Department of Health and Human Services Center for Faith. And we are thrilled for today's conversation surrounding the intersection of faith communities and recovery. We'll have some excellent panelists who are experts in their field and have a wealth of insight to share with you for this conversation. But before we turn to them, I want to take a moment to explain how we arrived at the topic today, because the timing is no accident. In January of 2026, President Trump signed the executive order launching the Great American Recovery Initiative, a sweeping effort to build stronger coordination across government, healthcare systems, faith communities, and the private sector, all in pursuit of one goal: confronting the addiction crisis that has touched so many families across the country. Not long after, HHS Secretary Robert F. Kennedy reinforced that commitment with a $100 million investment aimed at expanding treatment and recovery support nationwide. And critically, both the Substance Abuse and Mental Health Services Administration, or SAMHSA, as well as the Administration for Children and Families, have made something abundantly clear: faith-based organizations are not only not an afterthought in this initiative, they are welcomed, valued partners, invited to participate fully. With that in mind, we want you all to leave feeling equipped and able to name practical ways that faith groups can engage in the Great American Recovery Initiative. It's a joy to be with you this afternoon because the topic before us, this intersection of faith and communities and recovery, sits at the heart of why the HHS Center exists. Recovery is rarely a solitary journey. Addiction affects individuals, families, communities across the country, but in every person deserves the opportunity to seek recovery. But we also know that recovery is walked out in community. Family members who refuse to give up hope, neighbors who show up with a meal or a ride to a meeting, and congregations who open their doors not with judgment, but with grace. Faith communities play a vital role in this journey towards a holistic model of care, offering hope, reducing isolation, supporting families, and connecting individuals with recovery services and other local forms of support. This is how faith communities can become indispensable in the system of recovery. You, as faith communities, are often the first to notice when someone's struggling, the last to walk away when things get hard. You offer something no clinical intervention alone can fully provide: a hope that endures, a community that lifts us up, and a trusted bridge connecting individuals to recovery services and the local resources that can change the trajectory of a life. That is the holistic model of care that we're here to champion together. Our panelists today will bring a wonderful breadth of expertise and experience to this table. And I'd like to begin our introductions with two remarkable young interns who have already contributed to this mission significantly. Please join me in welcoming Kate Small and Miriam Daniel, both interns here at the HHS Space Center, who are both also rising seniors at Baylor University. Kate is studying corporate communication with a focus on health communication. And as if she doesn't have enough to do, she also has a double minor in advertising and entrepreneurship. She plans to pursue a career in marketing, continuing to work with faith-based organizations, community, and government organizations. Miriam is studying medical humanities in the pre-law track with a double minor in sociology and American Sign Language. She plans to pursue a career in advocacy and health policy, working to uplift communities that are often overlooked. And I can tell you, they're going to be successful in whatever they do because they have been so successful in helping, been instrumental in making this webinar possible. So Kate, it's an honor to turn it over to you. We're going to hear from Miriam later. And yeah, take it away.
Thank you, Ben. As Ben mentioned, my name is Kate Small, and I have had the privilege of serving on the HHS Center for Faith team this summer. It is my honor to introduce the director of the HHS Faith Center and senior advisor for the Great American Recovery Initiative, Dr. Monty Burks. Monty brings a wealth of information and experience in addiction recovery field and has dedicated his career to partnering with faith-based and community organizations to advance public health, strengthen human services, and build more resilient communities. Throughout his career, Monty has been a leader in the field of addiction recovery and prison reentry, working to connect individuals and families with hope, healing, and support. We are grateful for his leadership and vision, and it is our privilege to have him with us today. Please welcome me in introducing Dr. Monty Burks.
Thank you, Kate. Thank you so much. And first, I want to say this. It's been an honor to work beside you and Miriam. And Ben, thank you for giving them their flowers in that introduction. These are two remarkable young ladies that have really added so much to the Center for Faith. As you all know, this topic is something that hits close to home for me. Before I ever held a title in the federal government, I spent years in Tennessee building bridges between faith communities and the behavioral health system, connecting congregations to families facing addiction, championing for a faith office in the government, and getting to know people of all different walks of life. So believe me when I say this is personal to me. When I think about today's conversation, I don't think about it as simply a policy discussion. I think about the pastors, the volunteers, the recovery mentors, and all of those who show up week after week with no fanfare. And that's because I've stood alongside them and seen the work people like you have all done firsthand across this entire United States. That's why I believe so strongly in what we're building through the Great American Recovery Initiative. Faith communities have always done this work. What's different now is that the federal government is showing up as a real partner with resources, coordination, and a seat at the table for people who've been doing the hardest part of this work all along. Thank you for being a part of this partnership. I now want to introduce the White House Great American Recovery Initiative co-chair and the White House Senior Advisor for Addiction Recovery, my friend and close colleague, Kathryn Burgum. Kathryn is someone with lived experience, and she shares her story of how faith saved her and has helped her along her recovery journey. As First Lady of North Dakota, what a wonderful state, she worked to eliminate the stigma of addiction by sharing her story of addiction and recovery and encouraging others to do the same. She currently works alongside Secretary Kennedy, Dr. Tim Westlake, and myself, and many, many others who lead this country into widespread recovery from the chronic disease that is addiction. Kathryn, it is an honor to have you with us at the Faith Center today, and I will let you take it from here, my friend. Look forward to hearing your remarks.
Thank you so much, Monty, for your kind introduction and also for the incredible work you and your team do in so many different areas. You are inspiring and providing hope to so many. And I'm just so grateful to be a friend and be part of your team. So, well, hey, everybody, I'm so grateful to be with you today. And, there could be a technical glitch here because I'm not a technical genius, but I'm working on all of it. And hey, take a look at that. That's me in the Oval Office back there, which is not somewhere I ever thought I would ever be. But hey, I just want to talk about what we're doing with Great American Recovery. I want to talk about why it's important. And I think I'm going to talk about things that are going to be very familiar to you all, because here's the reality. It's somewhere in America right now, someone's making the hardest phone call of their life. They're finally asking for help. Maybe for the first time, maybe for the fifth time. And what do they get usually? Or not usually, but sometimes they'll get a voicemail when they make a call asking for help. Or there's a 6-week wait, or they have a prior authorization denial, and the system that is just broken and unfortunately for the people that reach out and need help. Like I said, maybe many of you are familiar with this kind of situation. But, when I started doing this work on the Great American Recovery Initiative, which I'll talk about in a couple minutes, I learned that 113 million Americans are impacted by someone else's addiction. I mean, this is a very, very prevalent disease across America. There's really a total of almost 180 million people impacted by addiction in America. And and that's what I had in mind when I decided to focus on the Great American Recovery. I just also want to point out that no other disease in America leaves a collateral damage of, 113 million people that are directly impacted. Alzheimer's doesn't do that, cancer, heart disease, none of those do. And one thing about addiction, as we know, is it just really can impact generations of people. And some of you may not be aware of this, that almost 800 people die every day from the impact of alcohol and drug addiction in America. Well, let me tell you a little bit about my story. I started drinking when I was in high school. I was a blackout drinker from the beginning. When I took my first drink in high school, I thought it was nirvana because I finally had the solution to the voices that were in my head that filled me with self-doubt, self-criticism, of a lot of negative talk. And when I drank, when I took those drinks, those voices in my head went quiet. I could talk to anybody and I felt free. And except for, that little thing of, having blackouts, when I drank, but I was willing to put up with that, for a while. In fact, for about 20 years, I kept drinking for 20 years and it was pretty much, a living hell. On the outside, it looked like I had everything. I had an MBA, I had a career, but, so it looked like everything was working just fine, but on the inside, it definitely wasn't. There were a lot of days I didn't want to get out of bed. I didn't really understand why, but now I understand. I had depression and anxiety. For the last 8 years of my drinking, I was relapsing very consistently. I'd get a year and I'd go back out, and I'd get 3 months and I'd go back out, and I just could not stay sober. I told myself, I've got an MBA, I can achieve any goal I set for my life, but I couldn't MBA my way out of, this chronic disease of addiction. So I rarely reached out for help. I got a DUI. This stigma just really prevented me from reaching out for help. I was ashamed, I thought I was a failure. And at the end of my drinking, I was suicidal because I had untreated depression, but I also just, could not figure out a way to stay sober. But one day I was out walking and um of I didn't have a lot of faith, but this voice said to me, maybe you should ask for help. So I thought, well, what could it hurt? Because I've tried everything else. And I basically just said, hey, I don't know if there's anybody out there, but I need help. And I have been sober since I said those words. And that was God intervening in my life. And I am so, so grateful because here I am in front of you today. And but I actually, after I got sober, I came to understand that, I have a chronic disease, and it's what I have is not a moral failure. So what we're doing, let me just talk about, well, here's one thing I believe very strongly is that our healthcare system does not treat addiction like a chronic disease, not the way we treat diabetes and other chronic diseases. We give people medications, we surround them with care, they're in the healthcare system lifelong. And what we do with, addiction is we'll give you 30 days. And if that doesn't work, that's it. There's just not a chronic disease approach to addiction, which is what we are focusing on through Great American Recovery. So on January 29th of this year, I had the privilege of standing in the Oval Office with the president when he signed the executive order creating the Great American Recovery Initiative. And basically what it means is that we are going to treat addiction like a chronic disease, like all other chronic diseases, and that this is not a moral failure. It is not a criminal identity. And for years, I'd been saying that addiction was a chronic disease. But this establishes that, this executive order focuses on that, and it calls for a full cross-government approach to creating better systems and processes for helping people. And, one thing I would love to do is just leave you with this, help us talk about addiction as a chronic disease. Tell your story, help eliminate the stigma by doing that. And I want to close with this, as I've gone too long, probably as usual, but I want to close with this and just say that, um, I tell people all the time to never give up hope for recovery. And, I am just so grateful, but more than anything, I'm grateful to be a face and voice of recovery, and so grateful to be with you today. Thanks so much.
Thank you so much, Kathryn, for sharing your story and talking a little bit about the Great American Recovery Initiative. We're so glad to have you here today. I have the joy of introducing our first panelist, Dr. Tim Westlake. He is the Chief of Staff at SAMHSA, which is the Substance Abuse and Mental Health Services Administration, as well as a Senior Policy Advisor for the Great American Recovery Initiative. He's a board-certified physician specializing in emergency medicine with over 25 years of clinical experience. Dr. Westlake has also played a central role in leading both federal and state policy efforts to address the opioid and fentanyl crisis, informed by personal lived experience as well as a commitment to integrative approaches that support resilience and wellness. The HHS Center of Faith has the privilege of working closely with Dr. Westlake and his team as we advance shared efforts to strengthen recovery and improve behavioral health across the country. Dr. Westlake has been a champion for expanding access in recovery and fostering collaboration among federal, state, local, and community partners. I'm going to pass it to Dr. Tim Westlake so he can share more about his role in this, and kind of talk a little bit more about what SAMHSA is doing. So grateful to have you here, Tim.
Great. Thank you, Miriam. I appreciate the introduction. Also, just wanted to mention that to thank Mrs. Burgum. It's been an honor and a privilege to work with her. She really brought this to the attention, and without her, there would not be a Great American Recovery Initiative. So, I really applaud her for the energy that she's brought to this. Again, as Miriam mentioned, I'm Tim Westlake, Chief of Staff at SAMHSA, just recently nominated to be Assistant Secretary of Mental Health and Substance Use. Again, this is my life's privilege, kind of the pinnacle of everything I've done so far. Spent my career in emergency medicine and with policy, but also more importantly, I think I'm in recovery myself. I've been in recovery for 29 years. And so I know this, apart from being an emergency doc and seeing the end stages of addiction as people reach the end of the disease process and their lives are destroyed and in tatters, but I've seen it in my own life, and, there, but for the grace of God go I. And I really feel like that. And I feel like I owe this to my family and to the community to do this work. So many families came through my emergency department in crisis and feeling hopeless. People struggling with chronic disease of addiction are often at the verge of losing their lives, and they do lose their lives. And I saw that all too many times. One truth I saw is repeatedly is that recovery is more than just simply abstinence from substances. It's about living a life of purpose, of connection with family and community, and building a life that becomes worth living. Stable housing, meaningful employment, social connection, and service to others all improve an individual's ability to sustain recovery. I know this isn't news to all of you. The science behind behavioral health is confirming what faith communities have long understood and practiced for generations, and that's that people heal when they are seen, supported, are hopeful and purposeful and connected. I learned in my initial recovery, in my initial treatment, that addiction is a disease, a physical disease, but it's got a spiritual cure, and I really believe that, and that's what's needed to really cure it. We know that when people need help, they often go to faith leaders first for support, hope, and purpose. And this is a perfect opportunity for screening and prevention and access to that system of care that we need to build up and improve to make it available so that people can get into long-term recovery and sobriety. We know that faith communities reach people that traditional healthcare systems don't. There's access to opportunities for spiritual needs initially, and then connect them with behavioral health care if needed. And we know that faith communities are positioned to offer trust, belonging, community, and these consistent relationships. And that are all the tenets of long-lasting recovery, apart from gratitude and appreciation for life itself. I think taking one day at a time really is a blessing that can't be overstated. We don't have to ask whether recovery should be faith-based or evidence-based. Faith and science complement each other. They can lift each other up, and that we can be better service to communities and individuals. Secretary Kennedy and President Trump share these sentiments, along with Mrs. Burgum, and they've challenged us to work differently than we ever have. All recognize the vital role that we play in helping people recover, supporting families, and strengthening communities. And faith is at the core and center of that. Through the Great American Recovery Initiative, we've been called on to work across society, not just within the healthcare system, to fully engage the faith communities as trusted partners in prevention, crisis response, treatment, and recovery support. This guidance has really been our North Star as we strengthen how we work with the faith communities, because we know that lasting recovery is strongest when all of us work together, and together we can reach more people than any one sector can reach alone. This is not just a talking point or a good, federal intervention, federal program. This is really about changing the core culture of America and embedding recovery principles and spiritual principles into our daily life. I'm proud to work at the work we've done at SAMHSA so far. We've engaged more than 2,000 people from faith communities to help them find and apply for grants within our $9 billion portfolio within SAMHSA. We've been building a network through our Faith Partnership in Action newsletter that we've published 2 issues already and have over 19,000 subscribers, I think, which is amazing. We've developed digital resources that can be used and adopted at no cost to faith communities, and our SAMHSA-funded training and technical assistance centers are working to scale faith and behavioral health models to work for more communities. We plan to host more convenings like this and webinars as we move forward on our 1.5-year-long plus strategy designed to focus, build upon, and sustain our efforts. And again, this is just the beginning. I really see this as a cultural shift that we're trying to build. We're expanding who we work with, how we work, and how we measure success. It's not just about dropping dollars out of the federal airplane into the communities. It's really holding and looking for measures of outcomes, and those outcomes are sobriety and recovery and long-term recovery. Recovery principles we're going to embed them or attempt to embed them in American culture and healthcare, communities, schools, workplaces, faith organizations, and in government programs, because a recovery-focused society is one where everyone has the opportunity to heal, contribute, and thrive. And I'm very proud to be a part of this administration, bringing faith and family up front and center to what we do in the Great American Recovery. And I'm looking forward to the great discussion and hope that it leaves each of us with a new idea, partners, and renewed energy for the work ahead. And again, thank you for everything that you all do on the call and to serve the communities. I think for most of us, this is a calling to action.
Thank you so much, Dr. Westlake. I appreciated your sentiment of talking about how faith and science can not only coexist, but also lift each other up. I think that's very encouraging for a lot of us here. Also, just want to encourage everyone in the webinar to utilize the Q&A feature at the bottom of your screen. We should have some time for a couple questions after, so feel free to drop a question if you feel inclined. But I'm going to introduce our next panelist, who is Stefanie Robinson. She is the founding executive director for Hope Recovery Community Center, located in Medina, Ohio. Hope Recovery Community is an organization that is led and governed by the recovery community themselves. This organization leads recovery-focused policy, carries out community education and outreach programs, and provides peer-based recovery support services. As a woman with lived experience, Stefanie combines her personal story with professional leadership to advance recovery-oriented systems of care. Earlier this year, Hope Recovery Community welcomed HHS Secretary Robert F. Kennedy Jr. During his visit to Ohio, he was able to tour the organization as well as meet with individuals who are in recovery to learn more about this community-based approach to recovery support. So we're really excited to hear from you, Stefanie. Thank you for being with us today, and excited to hear a bit more about your work.
Thank you so much, Miriam. Do I have slides somewhere? Okay, well, I'm just going to continue without the slides. My name is Stefanie Robinson, and I'm the founding executive director at Hope Recovery Community. And I'm also a person with lived experience. So for me, that means I haven't used drugs, alcohol, or engaged in eating disorder behaviors for over 18 years. Oh, I see slides popping up. There you go. Thank you so much. Okay. don't know if they're going to let me advance, but I'll just have them advance. So a little bit about me. This is my family. This is Piper. This is Jacob. John, my husband, he's also in long-term recovery. As you can see, this has become a little bit of a fishing contest for us, and the real stars of the show are Bogey and Bruno. Next slide, please. So 18 years ago, I arrived at an inpatient treatment center and I saw the sign, expect a miracle, when I pulled in. And I've got to tell you that I rolled my eyes and balked at the sign because I expected nothing. But in that treatment center, after 2 weeks of noncompliance, God met me in that place. And God created in me a purpose, a reason to live and a reason to wake up, and decided that drugs, alcohol, and an eating disorder were just not the path I was going to take. So I let God be in control. Little did I know that God had big plans for me, and that miracle truly did come. Next slide. Somebody said earlier about people, why they recover, and people don't recover because they stop struggling. We recover because someone chooses to see us beyond the struggle, right? We've heard this disease model, right? I'm not a bad person who made bad decisions. This is not a moral failing. This is a disease that's an incredibly treatable disease. And when we see people as God sees us, right? As God sees the treasure in all of us, and we meet them where they are, amazing things can happen. Next slide. And Hope Recovery Community is a result of that. 8 years ago, we decided that we needed more in our community. Little Medina, Ohio. This was a place that was not recovery friendly in any capacity. And we started a recovery community organization. People ask me all the time, are you faith-based? No, but we are faith-driven. We are driven by faith in a power greater than ourselves. We believe that recovery equals willingness plus opportunity. We believe that seeking help shouldn't be harmful. So we offer low barrier access to support. We want to make it really simple. We also believe in lived experiences engaged in every step of the continuum. So at Hope Recovery Community, we welcome strangers 365 days a year. We don't care where they're coming from, the insurance they have, the money they make, their bank accounts, their marital status, their race, their gender. It makes no difference to us. Next slide. We just want to meet them where we're at. You can see, and you can keep going through the slides. This is a beautiful facility. We have high quality, high standards, because people in recovery deserve nice things. We do basic needs. We also do a 24/7 linkage that will support 900 people this year to detox, inpatient, outpatient, using peers, using people in recovery to help other people in recovery. We care for people who are sick, right? We take on other people's burdens. We go into the jails, into the hospitals. It sounds a lot like the Gospels, if you ask me. Again, we're not a faith community, but I think we have one of the best churches in town because we're going out into the community and we're meeting people where they are. Next slide. People often ask what makes us different. I tell them that we're not really a church, right? But we strive to be the kind of community that everyone hopes to find in every church they walk into. A community where people are welcome without judgment, known by name, encouraged, and reminded that they have value. That's a community that you're going to find value in, and you're going to be able to sustain long-term recovery. Next slide. We also have a workforce development because we know when it comes to recovery, we need purpose and we need value. So we help create jobs, prepare people for jobs, and walk alongside with them. Next slide. Next slide. We do a lot. We have like 27,000 people that visit our center. 3 years ago, we thought big. We thought innovative. I shared a dream with somebody to start a farm, and the next day they said, Stefanie, you have divine interventions, because once again, God showed up, right? We just have to take that step of faith, and Hope Recovery Community Farm was built. This is a 17-acre non-clinical recovery farm. It's one of the largest non-clinical farms in the country. We have a level 2 recovery house with 16 residents there. We have like 30 chickens, a miniature pony. You can go through some slides if you want. We have goats. We have a donkey. Next slide. Keep going. Thanks. We have 9 beehives. We just pulled out 65 frames of honey. We process honey. This is our Hope honey. Next slide. We have goats, we have chickens. Goat math is a real thing. I said we were going to have 2 goats only. Here's 12 goats. Again, we're meeting people where they're at. We're meeting them with God's creation. We're connecting them to nature. We're teaching them workforce skills. Next slide. This is Sunny and our miniature pony dog, or our miniature donkey and Otis. Next slide. These are our gardens. We have 40,000 square feet of garden space. Next slide. Everybody always asks me, how much did you sell the produce? No, we give it all away. We've given over 14,000 pounds of produce back into our community to combat local food insecurity. You talk about the work of God, you talk about faith, you talk about purpose and community. We're using people in recovery, giving them significance. And then we have 5 free produce pantries in our community that we're feeding our community members. It's this beautiful cycle that really works well. And it's community collaboration at the highest level. Next slide. We also have recovery houses. So we currently have 47 recovery housing beds serving men and women. Next slide. And then I'm happy to say that I just bought our town motel. If you've ever seen the show Schitt's Creek, I literally bought that in our community. And you talk about restoration, right? When we talk about faith, when we talk about God, and we talk about recovery, we're literally taking our town motel and restoring it into a place that is going to serve men, women, and families with children. Next slide. This was the recent visit. We have lots of visitors come visit Hope Recovery Community, and this was such an honor, and we're so grateful to the secretary, his team, Mrs. Burgum, and the HHS staff. Next slide. So recovery flourishes when people encounter hope before judgment, belonging before barriers, and community before crisis. Faith communities have the opportunity to offer all 3. Next slide. Recovery is about restoration. Recovery is about belonging. Recovery is about hope. These aren't just recovery values. These are kingdom values. This is the faith community. This is God's work. Many of us are called to this, but how do we do this in community? Next slide. This is how we partner with our faith communities. Our faith communities have funded us. They've bought us. We helped them work together to buy us a recovery house. My seed money to open Hope Recovery Community was from a church. We work with our faith community of volunteers. They help us serve over 5,000 meals. They come in and do Bible studies. We are partners. They are visible in the community. And then our community goes into their churches and gives back. So it's a 2-way partnership and relationship. Next slide. So what can you do? Number 1, you can become the safest place in town to tell the truth, right? Recovery loses its grip when shame loses its grip and recovery begins. We create cultures in our churches that we don't have judgment. That means knowing the language of recovery, understanding the disease model, and we're here to help you. Recovery community organizations, treatment centers, people need to be able to see and hear you. We need to build relationships before there's a crisis. So you need to build relationships now. Don't wait for that to happen. And we need to love people long enough for hope to grow. Oftentimes the faith community wants to show up 1 time or 2 times. Keep showing up again and again and again and again. Recovery is rarely just one conversation. And don't underestimate the ministry of consistency. Build relationships. Next slide. Thank you very much. I appreciate the opportunity. And next, we'll take it back to Miriam.
Thank you so much, Stefanie. The work you're doing in your community and the ways that you're really just pouring into everyone around you is really inspiring. I'm overjoyed to introduce our next panelist, who is Michael Bowers from Bakersfield, California. He is the Vice President of Government and Public Relations for Centric Health California, where he leads partnerships, healthcare policy, and community engagement initiatives. He also serves as the chairman of the Bakersfield Recovery Services Board, where he has expanded their mission to deliver treatment to comprehensive substance abuse disorder and behavioral health services. As a partner at Psychiatric Wellness Center, Bowers aims to improve treatment and expand access in underserved communities. And outside of healthcare, Bowers is an affordable housing developer for justice-involved individuals and foster youth transitioning to independence. So Michael, we are so grateful that you're here with us, and I'm excited to hear a little bit about what you do.
Well, can you hear me? Thank you so much. I think I've got some slides. Well, first and foremost, what a privilege, what an honor, and what a responsibility. Thank you to Monty Burks, and of course, Kathryn, HHS, and to your incredible staff. I'm often told by faith-based communities, and there's a saying that they have, is if you're not at the table, you're on the menu. And for so many faith-based organizations, you have been on the menu, but HHS and Dr. Burks, you have been exceptional in making sure that these faith-based communities come to the table. I'm looking for my slide here. If not, so my first slide, trying to give you a little background about me. The gentleman in the photo was a gentleman who happened to be a hardcore Black Panther who went to prison, but later became a pastor. And that person is my father, the late Reverend Michael T. Bowers, who told me and talked to me about the work through Treatment First. And because of Treatment First, he was able to change his life. One of the things I talk about when I'm meeting with pastors and we're talking about mental health services is that my dad would often say that David didn't kill Goliath with prayer only, but he used the slingshot, and that slingshot was the tools for services like mental health and faith-based organizations. You can switch to the next slide. So a little bit about Bakersfield Recovery Services here in Bakersfield. We have been here for 40 years, partnering with the community, and we got a little different model, and there are some incredible things that we're doing under the tutelage of our executive director, which is Gilbert LaRue. We have been intentional with our outreach enrollment by connecting individuals and families to care through trusted faith-based organizations. I think it's important to understand that this work, when you look at faith-based organizations, they are trusted community partners. We saw that with COVID. They are trusted messengers, and people will often go to their pastor before they will go to their doctor. And so empowering these community faith-based organizations with the tools has been extremely important. One of the things that we really care about is evidence-based treatment. And for two reasons. One, we have approached this with an integrated healthcare model. And that integrated healthcare model connects our folks that are JI getting out of prison. We connect them with psychiatrists, we connect them with primary care physicians, but more importantly, we're connecting them to the services that they need that are going to be sustainable. Our approach is not shoot first and aim later. Our approach is to make sure that we get people onto a path of sustainability. We know that prayer works, and it's great to have a praise report, but in that praise report, the question becomes, how are you measuring success? And so we've seen that that we have great ways of getting outcomes, but it's important to measure success. And we have exceptional partners like Alexis Taylor and Tamika Powell that really help us put the data to measure the success because that is an exceptional part in terms of how we're going to monitor our outcomes. And so we're doing that work. One of the things I will always say, and I think is so important and indicative that your organization understands is partnerships. We believe in collaboration. I often say people who compete don't complete. Collaboration has been important for us. We are so honored to partner with our district attorney's office, who fostered and took on our governor and won Prop 36, which offers mandatory treatment. That mandatory treatment gives individuals the opportunity to either you do your time or you go into mandated treatment. That mandated treatment has been exceptional because it has helped us work with doing warm handoffs with organizations. We saw this work several years ago, and we just couldn't get the outcomes. $24 billion spent in California on housing first, and still no one is housed. But we have looked at this from a treatment first model, and we are starting to see the success that warm handoffs are essential if we want to get the outcomes. More importantly, if we want to bring down utilization. One thing I say is that numbers show that 10% of the population that we focus on are utilizing 50% of the services. One of the things that Bakersfield Recovery Services, we always say, look, when you take shortcuts, you get cut short. And you can't take shortcuts in this work. It's important to have steps. It's important to have warm handoffs because those are going to lead to sustainability. We are about a 130-bed facility, inpatient, outpatient, detox. We're the only facility with we call it our perinatal, but our mommy house, that really focuses on reuniting the mothers with their children while they're in recovery. In our 130 beds, we have seen some major success through our partners. With the district attorney, our partnership has allowed mothers and JI folks that have gone through our program to eventually get the expungements that they need to get back into work. We are one of the only facilities, I would say, in the Central Valley that offers the opportunity to come on site with a district attorney, our courts, as well as probation, and our partnerships that are in law. And you can come to our facility. And one of the unique things is that we have judges, the DA, and in our pre expungement clinic, you can get your record clean right there. You don't have to go back to court. And we have seen that has moved people into permanent sustainability. Housing. I go to housing because treatment first is important, but California has given a lot of housing without the treatment first. So we have focused on treatment first, getting better results, and workforce development. We are so honored to partner with CRC, one of our largest energy companies that are offering jobs. We are now starting to partner with CAL FIRE, which are offering folks a baseline income of $90,000 who complete those programs. Folks, that is how we move people from poverty to prosperity, and we get them into long-term sustainability. Of course, we have our food distribution. We've impacted close to about 12,000. Our residential enrollment, ensuring timely access and a structured program has been indicative and essential. But more importantly, HHS, you're going to love this. We have brought down utilization just by those warm handoffs. What we saw is that people access the urgent care as primary care versus utilizing PCs, primary care physicians. So what we have done is instead of giving an $8,000 or $10,000 bill just to see a doctor in the ER as primary care, we have brought down the utilization by connecting these folks through our integrated model to primary care physicians. You can go to the next slide. And as I said, the faith community has been essential and has been pivotal in connecting as trusted messengers. We are doing the work on the ground. We have an incredible team. We have incredible partnerships. We have partnerships across the state. We have partnerships that are local. We partner with T. Johnson with a launch pad at Bakersfield College. If you're JI and you're looking to get into opening your own business, we have an incredible entrepreneurship that provides a $10,000 grant. We do this work with the thought process in mind that we have to get to the trauma of folks. As I often say, trauma isn't your fault, but healing is your responsibility. And so we're working to give people the tools to deal with the trauma and the triggers. And then also to those social needs in healthcare, in the investment in housing. But our goal is to get you to sustainability, because if we can get you to sustainability, what we understand is that sustainability is what moves people from poverty to prosperity. Thank you.
Thank you so much, Michael. We appreciate all the work that you're doing in Bakersfield, California, really equipping faith communities with true evidence that's going to end up making a big difference in the future. So, and right now. So I'm delighted to introduce our final panelist, who is Josh Torbich. He is the Chief Executive Officer of Christian Recovery Centers. This North Carolina-based nonprofit is dedicated to providing faith-based addiction recovery services, transitional housing, and support for individuals and families affected by substance abuse disorders. In addition, his leadership at Christian Recovery Centers, he also serves as board president of the Bridge to 100 Network and as Bluegrass District President for Citygate Network, where he works to strengthen partnerships among faith-based recovery organizations as well as community leaders. Throughout his career, Josh has been committed to expanding access for recovery services, promoting long-term recovery, and equipping faith communities to play meaningful roles in supporting individuals overcoming addiction. Through his leadership and advocacy, he continues to advance collaborative, community-based approaches that foster hope, healing, and lasting recovery. Josh, we're so excited to have you with us and to hear a little bit about your work.
Thanks so much, Miriam. Yeah, it's great to be with you all today. Thank you for the opportunity. What a cool place that we're at right now for us to be even having this conversation. So yeah, the sentiment of just saying thank you, Dr. Burks, Ben, Kathryn, all of the folks over there who are just trying to create this pathway so that we can directly show folks the evidence that's directly behind how effective faith-based programming is such a beautiful thing. I'm also happy to share that I came stumbling through the doors of a recovery program just like the one I get to lead today in 2013. Since then, God has just continued to create pathways of opportunity for me to be able to share my personal testimony of finding freedom from drug and alcohol addiction, horribly addicted to heroin, horribly addicted to alcohol. And you guessed it, yeah, God created a way for me not just to find sobriety, but my ultimate purpose in life. So I'm super grateful for that and to get to share a little bit of that with you today. I want to talk to you a little bit about our framework at Christian Recovery Centers and share with you something that we've been slowly but steadily building over the past 4 years and kind of the results of it. If you would move to the next slide. Christian Recovery Centers operates 2 regional locations inside of North Carolina. Our primary location is in Brunswick County. So if anybody wants to come visit us, just so you know, we're at Ocean Isle Beach. It's the perfect place to scheme on a work trip down this way. So we currently operate 243 residential beds. We also have about 55 shelter beds with some additional respite beds that work in tandem with our local hospital to reduce that revolving door that Dr. Bowers was discussing that you see inside of those emergency rooms when folks kind of trickle in and trickle out. So we've created space for that. Our program runs for up to 2.5 years. We start out with a treatment program on the front end, recovery, the really thick work right in the middle of it, and then eventually they get themselves into a place for 18 to 24 months of reentry services, supporting full community reintegration. Next slide, please. So we set out to create something that we knew we needed to solve some problems, and a few of them we were able to find through a very meaningful partnership, a few of those solutions. And we created and actually got ourselves into a few years ago what was considered a true biopsychosocial spiritual ecosystem. And let me tell you, our place was really good. As a faith-based therapeutic community, we knew how to love people. We knew how to support people. We really knew how to create an environment that could reach their aspirations. You know, our belief and philosophy would approach people right at the door, and it would say, hey, you're the best version of you whenever you wake up the next morning, and the person you were yesterday you feel really proud of. And watching people pursue their potential and then encourage them that their current place of potential isn't even as high as their ceiling gets is a beautiful effect that we've gotten to watch. And we found out that aspiration and faith, those 2 words work in tandem together. We knew that we could increase our effectiveness in some ways if we found a partner. We did have some pauses around what we would experience in partnering with a clinical program, and I want to talk about a way that we wrestled with some of those things as we go. But what you're looking at is our entire model of care. Our participants' pathway travels directly down the middle of these 2 ecosystems of care where faith and science both overlap with each other. And you can see some of the different supportive services that are found within the framework of our program while people travel through that program. You know, one of the things that we were really timid of a few years ago when we were first kind of rebuilding and reshaping this model was the idea of what our experience looked like with knowing that from our experience, folks didn't necessarily need long-term MOUD as a common component of long-term recovery. And we thought that if we opened up the doors to introduce some more clinical programming, that's what we would find. We would find that many people would continue on that clinical pathway of MOUD. And as we worked with those two different worlds, we found a great clinical provider who was able to prescribe medications for medications for opioid use disorder when they were necessarily needed. And then in other cases, we're able to still allow people to keep their aspirations to live a true abstinence-free life. Next slide, please. The partnership that we were able to create worked in tandem with University of North Carolina. And one of the things that we set out to do with this model of care that we've created, the biopsychosocial spiritual ecosystem, was create a research project. Our Senate has funded for about the past 13 years or so a body called the North Carolina Collaboratory. That collaboratory exists to go on to fund research projects partnered with local universities who are going to go on to influence state or local policy. We were the first faith-based organization to be funded by that Senate-funded body, the North Carolina Collaboratory. That directly created a relationship with our local university. Now, this is my favorite part. That local university came in, and as they started to understand the shape and the format of our program, we also began to work with a lot of the folks who were assigned to the research side of the project. And we implemented what was considered aspires and working in a 6-dimension framework of overall well-being. We said we know our program's effective. We have a lot of testimonies to prove. We have a lot of proof on the other end where people would leave and go on to live successful lives. But we really didn't have the evidence per se inside of our hands to be able to prove that our faith-based program was effective solutions for ongoing long-term success inside of recovery. So they built this framework. We would measure folks inside of these 6 dimensions of care, taking them from a place of overall suffering into a place of overall thriving. And this was what established in the Bridge to 100, what we've been able to effectively implant into about 35 other faith-based agencies across the state of North Carolina. Next slide. The pathway to self-governance was nestled inside of this entire experience with the University of North Carolina. You know, it's a true statement for most of us, especially those of us with lived experience. When you first enter a place like ours, or the different recovery programs or opportunities for non-residential programs that are on here today, they step into a place, their life is really simple, but their life sucks really bad. Like, that is the ultimate state of suffering, that when they first step in, there's not a lot going on. It's not hard to understand, but they're definitely in a place of overall suffering. Our job, while their life propels itself, is to prepare them for this idea. The person that they hope to become in their life, and tell me if this doesn't sound aspirational and faith-based at its core, the person that they hope to become in their life is a place of overall well-being and thriving, but that life is extremely more complicated than the one that they've recently experienced. So our program took a specific framework, leading people into a pathway of self-governance, but preparing them for an extremely complicated life. And that's how we kind of set the why behind a lot of the new additions that we added into our programs. Next slide, please. This is what I wanted to show you, and we're kind of getting into the last parts of the slides, but I've pulled these up and wanted to make sure everyone got a clear sight line of this. This is a real program participant who entered inside of our program, one of the first people who were able to interact with what our new model of care looked like and partnership in tandem with the North Carolina Collaboratory Project. And you can see in that 6 dimensions of well-being that I shared with you, there was about 51 indicators that we would have them surveyed, going through the different sentiments of where they are. So you can see this person, I have sufficient savings, I eat a healthy diet. You know, at the core, a faith-based program is aspirational, but all of these other plugs to get somebody to where they actually need to be. Next slide, please. This is what we found with this one individual 6 months after their completion of the program. We gave our peer supports, our direct care staff, an easy, tangible way to be able to see the power of faith-based programming in evidence form, and this was a phenomenal aspect of it. Next slide, please. One of the things that I really wanted to highlight is the overlayment that we've been able to see. When you look at all of the people who've been served through our programs over the past year, and I think that's what this is, just a year's worth of framework, almost 1,500 people were engaged with. That's 995 families, participated in 1,481 different engagements. And look at the first one, 87% positive change in just what? Feeling connected to a community. Y'all know what the opposite of addiction is? It's community. And that's what they felt when they traveled through programs like ours. Next slide, please. Another highlight for you is that they saw an 86% positive change in addiction, 93% in goal setting, 94% in food security. This is the power behind what we're creating for folks to be able to come in and say, you don't just have phenomenal testimonies, but what you have is evidence partnered with a formal research institution at University of North Carolina. Next slide, please. I do want to say that if anyone wants to take us up on the offer, come visit us, come see us at Ocean Isle Beach. Our model that we've set out to create and our partnership with the University of North Carolina is completely replicable. So if anyone wants to have the roadmap how to implement something like that up in their state or in their different recovery program, if you want to reach out to me, scan the QR code. We would love to connect with you and be able to participate in helping you build a similar infrastructure for your community as we have. And I'm going to give it back to Kate. Thank you for listening.
Thank you, Josh. This has been such a meaningful conversation that we've had today. Our panelists have shared the importance of meeting people where they're at, expanding access to recovery supports, leveraging lived experience, and building communities where hope and healing can flourish. So thank you. So we will now open the floor up for a few questions. Dr. Westlake, the first question is coming to you. What has stood out to you from the presentations today, or what takeaways do you have from today?
I'm honestly just blown away by what I've seen with the three presenters and the programs that they have. Those are just like the ultimate expressions of what recovery and faith should be. And it's just like, I mean, I had chills down my neck multiple times seeing what y'all are doing. That's just, I mean, that's amazing. Like, to me, that feels like I feel like you kind of channel the spirit, and I feel like that's the expression of that kind of coming out. I always felt when I worked in the ER, like it wasn't me that was doing stuff. I was just a conduit, and that's what I see. And it's just like, if we can replicate that, I mean, that's like the revival in the country that we need to restore the family. And it's amazing. I'm just humbled to work with y'all in this.
Completely agree. Thanks for sharing. One other question that we received is, as faith communities and people of faith, how can you be helpful without enabling someone's challenges with addiction? Would anyone like to answer that one?
This is Stephanie at Hope Recovery Community. I think the key is just to get educated. Again, don't wait for the crisis. Don't wait for they're going to show up. They're in your community. They're in your congregation. We are everybody's impacted by addiction. So I think it's about supporting people, meeting where they're at. But if you get educated on what truly enabling is and how you can meet people with loving them with tough boundaries and maybe not all the tough love, like figuring out that balance, it's a real key. And utilizing people with lived experience. So our faith communities, they reach out to Hope Recovery Community because they're like, well, we're just going to love them, and then we're going to get them connected. And then like a Josh, where we get them connected to treatment, and then we're non-clinical. So, right. And Michael, we all kind of run in our own lane. So it's understanding all those pieces and working together. We're all working together for one mission. But I think it's more just focusing on loving a person and just having an understanding of what substance use disorders are and truly what recovery is.
That's great. Thank you for sharing. Another question is, do any of these presenters from today have partnerships with houses of worship, and what do those partnerships look like? Do houses of worship send referrals to their treatment programs?
Yeah, so we're actually really established at Christian recovery centers with our houses of worship, so much to the extent, especially on the reentry portions of our program, in our parking lot or at our different facilities, you will see multiple different buses moving in different directions going to visit these houses of worship. And as far as the referrals back in, we are normally invited to host at multiple churches inside of our region just to build that awareness. I can't tell you how many pastors are in my Rolodex right now who they would even say this. I don't know a lot about addiction recovery, but I know a group who will get somebody right down the road to us as soon as we need it. And that's become the truth about our organization, is just being able to show up so that they don't really have to overly expand their knowledge and what to do for somebody, they know who to pick up the phone and call.
And one of the things that, and just to echo Josh there, we are partnered with the mission here in Bakersfield, California. And the mission is a faith-based organization and also a form of a house of worship. So we do a lot with the mission, Carlos Baldovinos here in Bakersfield, California.
We have several faith communities, different churches, different organizations that will bring people to our recovery centers so they know that it's a low barrier access to support. And like Josh said, they'll get connected to us, and then we can refer to a clinical provider, but we'll build community. And so they'll have a kind of a faith piece, a treatment clinical piece, and then a non-clinical recovery support piece, which is a really nice pathway for somebody entering and sustaining long-term recovery.
That's great. Thank you guys all so much for answering the questions. That is all the time we have for questions. I want to again say thank you to all of our distinguished panelists for sharing your expertise, your leadership, and your commitment to advancing recovery. And thank you to everyone who joined us today. We hope that this conversation has inspired new partnerships and equipped you with practical ideas to support individuals, families, and communities on the path to recovery. It is now my pleasure to turn it back to Dr. Monty Burks for our closing remarks. Thank you.
Kate, what a wonderful job today. Kate and Miriam. Can everybody give me an emoji or a reaction for Kate and Miriam, the two most energetic interns in the United States of America? Thank you both for such a wonderful job today in putting this webinar together. It's been an amazing journey with you over these last couple of months, and I'm honored to have spent time with you. So thank you for this good work. And I see that our partners across the country are also giving their flowers to you. You deserve them. Giving you your flowers, you deserve them. One thing I want to leave with all of our panelists, I really appreciate all of you. I know all of you in some form or fashion, have spent some time in conversation with all of you. Thank you for sharing your work and also sharing the concept of how faith communities can be involved in the entire walk of a person through some of life's most unique circumstances, and also giving a voice to our other faith providers. It can be a one-man congregation or a $20,000 entity, a 20 million people entity. All of it matters when you're providing services to people. Stefanie, your farm, what you've done in Ohio is amazing. Michael, you're out on the West Coast, out in the middle of the desert, providing love and grace for people. And Josh, you're out there in North Carolina with a beehive and a garden that I walked through. Terrified I might get stung, but loving the fact that you guys are in the mix with people who I know have never in their life been around bees before. We thank you all. And again, appreciate this. And I'm going to turn it over to Ben so he can give you some closing information.
Monty, thank you so much. Thanks to everybody who's joined us today. We've been honored to have you all. Again, want to echo the appreciation. Thanks for our interns, as well as our other intern who's not able to be with us today, Damar Richards. We so appreciate all of the work that they are contributing to the work of the center and are able to connect and coordinate. We know that there have been more questions. We can't get to all the questions that we always have for these webinars. You can send those questions to us, as well as engagement, conversations, things you want to tell us about at faith@hhs.gov. That's the word faith, the @ symbol, and then H for health, H for human, S for service.gov is the way you can always reach us. Let us know what you're looking for, the resources that would be helpful. And then make sure you will let us know if you want to sign up for our newsletter so you can hear about our next webinar coming up in August. We want to talk to you about the important work happening around the country through the 988 system that makes sure people have a resource that they can call if they're in crisis. We're going to be talking about that ahead of September and all the key events that are coming up on those dates, ways that faith and community-based groups can be involved in this work. So make sure to sign up. Let us know if you're not getting our newsletter. Reach out to us at faith@hhs.gov. You can also always connect with us through our website at www.hhs.gov/faith. hhs.gov/faith. And we look forward to staying in touch with you, to continue coming to you, sharing about keywords and lifting up amazing work like the work we've heard today going on around the country to support this work. Thanks so much for joining with us today. We'll see you next month.